Democratic Congresswoman Nanette Barragán of California, a fierce advocate for working-class families, sat across from some of the most powerful executives in the insurance industry, including UnitedHealth Group's Mr. Hemsley, a man who pocketed a $60 million equity award while families in this country are declaring bankruptcy over their children's medical bills. What unfolded was not just a hearing, it was a reckoning. And while Republicans in Congress continue to shield corporate interests and push for deregulation under the Trump agenda, it was a Democrat who looked these executives in the eye and asked the question every American deserves an answer to. Why do families have to fight you just to survive?
California, Ms. Barragán, for her 5 minutes of questioning.
Thank you, Mr. Chairman. I want to just ask the witnesses, all of you here, except the witness on the end, all of you get a stock option or a stock benefit for your compensation. Is that correct, Mr. Hemsley?
Yes, Representative.
And Mr. Joyner?
Yes.
Ms. Bordeaux?
I do as well, tied to long-term incentives.
Okay, and
Yes, I do. No, we don't have any ownership or stock. We're a nonprofit. There's no ownership.
okay, you get you get performance bonuses instead.
Correct.
Okay, so those of you who have stock, your company has to do better or good for you to maintain that value in that stock. Is that right? Nobody disagrees with that, right? You're all in the business of making a profit, right? Nobody disagrees with that? Okay. Mr. Hemsley, you got a $60 million one-time equity award. That's a lot of money. For my constituents, when I said we were having this hearing today, I said, what would you ask? They said, we want to know why they're making so much and why we can't afford our health care, or why we stretch every penny and dime to buy health care just to have the claim denied when I actually need it. And that's what's wrong. That is what's wrong in this system. Mr. Hemsley, you were just asked about the denial rates. I have a chart. I have a chart right here of the denial rates. Now, I don't know if you could see it, but UnitedHealth Group, according to the Kaiser Family Foundation study, says your in-network denial rate is 33%. That's 33%. You just told my colleague that wasn't accurate. Are you saying the report is inaccurate? Or are you just not aware of what your denial rates are?
Representative, I think we are aware of our denial rates. I don't know the context of what you're showing me.
Okay, so you're not aware of the study. Okay.
Excuse me.
Well,
Mr.
what do you
Hemsley,
think your
can you
denial
put
rate
your
is?
mic
What do you think the
closer?
percentage is?
Yeah, we're having a hard time hearing. If you could pull your mic closer, and we'll give you an extra
Sorry.
10 seconds.
Okay.
What do you think your denial rate is?
Less than 2%.
Yeah, that's like wildly off from any numbers that I have seen. I want to enter into the record an LA Times article published in February 2025 that tells the story of Colleen Henderson and her 3-year-old toddler, who of course is insured by UnitedHealthcare. They fought your company for 5 years to pay for specialty care to treat their 3-year-old daughter's rare condition. She had a tumor in her bladder, The family ended up with $1 million in medical debt and was forced to declare bankruptcy because UnitedHealthcare said treatments recommended by the doctors were unnecessary. Do you understand why the American people are not a fan of UnitedHealthcare and big healthcare companies, Mr. Hemsley?
I think that is a tragic situation. I don't know the details of it, but I'm very sympathetic to situations like that.
Well, what are you going to do to make sure that more families are not going into medical debt and that their kids can get the care they need? Because you know the alternative is the kid is going to die.
Well, I'm glad you brought that up because I think one of the reasons that motivated me to return to this company is because I think we could be a force for solutions like that, and that our mission aligns to that, and my purpose is to improve the performance of this enterprise to solve those kinds of solutions.
Well, I hope that we see improvements, and I'm going to be tracking that progress to see if it actually happens. The other thing that's really quite fascinating is that we find that most people will not appeal these denials. Most people don't have the time or the effort. I live in a district where it's working class families. They can barely find the time to show up to 2 jobs to pay their bills. Do you think they're going to have the time and the effort to appeal a claim? We've seen that less than 1% of claims are appealable. When they are, insurance reverses their decision 44% of the time. That's almost half. Why do your patients have to fight your company to get their claims covered?
Representative, again, I appreciate the subject. It's important. They shouldn't have to fight. We should make this much easier and intuitive, and we use technology for that purpose. We have a number of initiatives in market right now.
Mr. Hemsley,
try to make it real
the
time.
way you're talking about this is not sympathetic. It's not compassionate. I appreciate the topic. These are people's lives. These are children's lives. This is when people, you said that you want to help people when they're sick. You know what doesn't help? When they get a bill or they have to go into medical debt for $1 million of debt. That doesn't help people when they're sick. I hope that you all are going to do better.
The gentlelady yields back, and the gentlelady referenced a document. If she could make sure we have a copy of that, and without objection, it is so ordered to be entered into the record.
Congresswoman Nanette Barragán, representing California's 44th District, a community of working-class families, immigrants, and people who know what it means to stretch a dollar until it snaps, did what too few in Washington are willing to do. She looked one of the most powerful men in the American healthcare industry in the eye and demanded answers. Not talking points, not corporate pleasantries, answers. And what did she get? She got a CEO Mr. Hemsley, who collected a $60 million equity award and then sat before the United States Congress and claimed, with a straight face, that his company's denial rate is less than 2%. 2%. Meanwhile, the Kaiser Family Foundation, one of the most respected nonpartisan research institutions in the country, puts that number at 33%. That is not a rounding error. That is not a difference of methodology. That is either a staggering display of ignorance from the man running one of the largest health insurers in America, or it is something far worse, and I'll let you decide which. But the numbers, as damning as they are not even the most devastating part of this hearing. It was the story of Colleen Henderson, a mother who fought UnitedHealth for 5 years, to get coverage for her 3-year-old daughter who had a tumor in her bladder, a toddler, and the result? $1 million in medical debt, bankruptcy. Because a corporation whose CEO earns more in a single bonus than most Americans will see in 10 lifetimes, decided that a doctor's recommended treatment was, quote, unnecessary. A for-profit insurance company overruled a medical professional to protect its bottom line, and a family was destroyed because of it. And here is the statistic that should haunt every single one of us tonight. Less than 1% of denied claims are ever appealed. Less than 1%, because the system is designed that way. It is designed to exhaust you, to outlast you, to bet on the fact that you are too tired, too overwhelmed, too busy working 2 jobs to fight back. But when people do fight back, when that tiny fraction musters the strength to appeal, insurers reverse their own decisions 44% of the time, almost half. Which means these companies know that nearly half of their denials cannot withstand scrutiny. They are counting on your silence. They are profiting from your exhaustion. And what was Mr. Hemsley's response to all of this? I appreciate the topic. Congresswoman Barragán was right to call him out. While Democrats fight to expand coverage, cap out-of-pocket costs, and hold these corporations accountable, the other side of the aisle has consistently chosen the side of shareholders over patients, of executives over children, of profit over people. Congresswoman Barragán said she would be tracking their progress.